Carpooling with Ben. Folks, if you know somebody out there who's dealing with an illness that is serious and is possibly being studied, perhaps there's no real known cure at the time. We all know the various illnesses out there like that. You've often heard of different studies, and there's really no one place to go for a clearinghouse. Well, great news. Depending on when you watch this, that organization is just about to start. Let me introduce to you one of the co-founders of fasttrek.org, Jaime Lavoie. Jaime, thanks so much for joining me in the car today.
Thank you so much for having us. We're excited to be here.
It's great. You're the co-founder, director of facilitation. This is a startup, so you do anything and everything, including getting people's cars that have multiple GoPros on the windshield and stuff. So.
Yeah, anything to get this message out and to get this resource out.
Well, it's a great message, and it's funny because the co-founder, Nicholas Cardi III, good friend Nicholas, we miss you. We wish you were here with us right now. When he was talking to me originally about this idea a while back, he said it's kind of like a Match.com for studies and patients. So I've really simplified it. You can tell the story a lot better. So what is FastTrek.org?
So Fast Track has come a long way. It was an idea that we were bouncing around with about a year ago, and basically with what Nick and his family went through is what a lot of families unfortunately have to go through. If you're battling a disease that does not have a cure for it right now, which brain cancer and MS have no cures, that's why we're specializing in them, then it's really hard to find new and active treatments, especially with something like brain cancer, where the prognosis is usually poor.
And rapid, and it's a short window.
Yes,
small window.
Extremely short. So it's really important to have all your treatment options available to you so that you can make the best choice for the patient, for the family. So we came up with this resource, fasttrack.org. It's quickly connecting patients to clinical trials. And basically what we do is the user makes a login on our website. It's completely free and available to anyone who would like to use it. They put in the distance that they are willing to travel and some inclusion-exclusion criteria on their disease. And we make a completely free personalized report for all the clinical trials that they appear eligible in that given radius of their choosing.
Wow.
And then we take it a step further. When you start diving into clinical trials, it gets a little complicated and there's always new stuff coming online.
So, we talk about the window of opportunity or the prognosis time. With brain cancer, it may be short. With MS, it could be long-term, but there are different stages, and those windows are varying. The whole point of creating this organization is really to make this like one-stop shop, because as of now or before Fast Trek has been formulated, it hasn't been that easy to find these studies.
Right. So, which is really disheartening because clinical trials, the way that they are designed right now, so incredibly specialized, so incredibly advanced. It's a great resource to be able to be connected to these clinical trials. And a lot of times you can pinpoint a clinical trial made just for you, especially with something like MS. There are a lot of varying symptoms and a lot of it is recurring. You're not on as strict of a timeline as brain cancer, but because both of these have zero cures, a clinical trial is a great option for you as far as treatment goes. The standard care is just lacking a little bit. Like we said before, no cures for either of these diseases. So being able to have a personalized report of all your treatment options and being able to sort through this treatment report, print it out, bring it to your doctor, be able to ask questions on it is a fantastic resource for people to have.
So there's really two users for this program, if I'm understanding correctly. There's the person who's going through the unfortunate circumstance of the diagnosis, but there's also the organizations, universities, hospitals, doctors' offices, everybody out there who are sponsoring these tests and putting these studies together. You need help from them as well, because you need to kind of match them up.
Yes, and with the disconnect that's currently happening with clinical trials, it doesn't just affect that singular patient. When a trial is put on hold because they don't get enough people put into it, then it backtracks progress on the disease, it backtracks money for the pharmaceutical companies, and then we also kind of lose out on potential cures. If a clinical trial can't be held because not enough people enrolled in it.
I never even thought of that.
Then,
you need a certain amount of people
yes, and
to sign
sometimes
up.
These great treatments can't even be tested, so they go without us knowing.
Wow.
Yes.
So that really raises the importance level of this entire
Yeah, and then
organization.
if you
so
dig
you guys
a little,
really are a Match.com for
we are Match.com
study
for clinical trials.
Study and patient. That's
yeah,
wow.
and if you look at the reasons why people aren't participating in clinical trials, the top two reasons are: one, a patient didn't know about them, and two, they didn't know where to go to find one.
Wow,
And
okay.
that is not necessarily their doctor's fault. The way that we kind of explain it is it's like going to a restaurant. So you go to a restaurant, you go to the Greek restaurant, and you read the menu, but they can't tell you what's on the menu at the Italian restaurant down the street or the Mexican restaurant down the street. So a hospital might have one or two clinical trials running that they can tell you about, but you can't expect doctors to know every single clinical trial that is happening in the world. There's so many trials running right now that it wouldn't be realistic to put that pressure on them. So you have to do the research yourself, but we make that step a lot easier by giving completely free and personalized reports.
If doctors or organizations are sponsoring these different research trials or these tests, how can they best connect with you and also follow that up with potential patients and clients to learn about those opportunities? What's the best way?
A person can create a login on our website, and we will give them all of the clinical trials that they appear eligible in the given radius of their choosing. And we also take it a little step further. We give them weekly updates.
Okay.
So this kind of separates us from other clinical trial websites that are currently being used. Clinical trials are constantly rapidly evolving, changing, new ones are coming online, offline. So we update the user if there is a change in status to their initial report, or if a new trial comes online. So you might do the research today and you get all the clinical trials that you think you might want to try, and then tomorrow a brand new one completely targeted for something that is so specific to you comes online, but you don't know about it because you did your research the day before. We make sure that you don't miss anything.
I really like that element of it, the weekly update and that ongoing sense of hope, because that's an important element to
Yes.
any patient with any disease, is that hope and that optimistic view. So let's drop the website again, and the social media links so people have them.
Yeah, so it is fasttrack.org. Fasttrack as in FASTTREK.org. On our website, we have the links to all of our social media. And then if you would like to join us, we are doing our first fundraiser and launch of our software. It will be held on Wednesday, 9/5 at 5:35 at the Roger Williams Botanical Garden. So it's going to be a really nice event.
Awesome. People can keep up with you by following you. Jamie, thank you so much for joining me in the
much.
car today, and really wishing you guys all the best of luck. I truly am just blown away by the fact that nothing like this has existed up until this point, and kudos to yourself and Nicholas for putting this together. I think it's a wonderful thing, really helping to put a cure on the map for these terrible diseases. And I'm just excited to see that some of these trials. I had no idea that some of these trials just stopped if they didn't have enough people. It's like, oh, well, you have no. They need the certain
Test that treatment.
Absolutely. So this is great. So congratulations to you. Wish you all the best of luck going forward.
Thank you so much.